Spiritual Companions is the program I referred to earlier. By the way, I should point out that there are a number of sisters, this is one of our sisters, of sisters, all in habits, as I'm sure you've noticed. That includes, of course, the Sisters of St. Francis. But we also have a number of other sisters who have chosen to work with the Sisters of St. Francis, including our hospitals in the northern Indiana region, because they feel as though they will be supported. This is an Indian order of sisters who have a number of nurses who are working with us, and also have a convent in our area. It is our practice to bless everything, as the slide indicates. If it's going to be put into service at one of our hospitals, we make sure that we bless it. Here, one of our chaplains is blessing one of our mobile coffee stands. So this is one located in the lobby. When this service was rolled out, we formally announced it, invited everybody to come and participate in the ceremony, and we blessed it. We blessed everything. Here's our regional guide. We put out a twice weekly newspaper on email to all the folks in the northern Indiana region. This is one of my attempts to keep everybody together. It begins, although you can't see it very clearly, it begins with a spiritual reflection for folks in the region, and then updates them on news, including, as I mentioned earlier, some of those blessings and dedications. We have chapels in 4 of our facilities. Franciscan Physicians Hospital, for reasons perhaps some of you can understand, does not have a chapel yet. But Colleen led our gala committee last week in a major fundraising event at Soldier Field in Chicago, where we had almost 950 people in attendance. And the purpose of the gala was to benefit a number of our spiritual and mission programs, including the hoped-for construction of a chapel at Franciscan Physicians Hospital. All of our chapels are located in the hospitals. There is daily Mass in each of these chapels. There is a Mass in virtually all these chapels more than once a day, usually twice a day, and once on Saturday and Sunday. There is Adoration in each of these chapels several days a week, and we're very pleased about that. As Steve indicated, we try to, wherever possible, exemplify and remind folks of our religious heritage. You can't go more than a few feet without finding a statue or a painting or some artwork, Catholic in nature. We also have San Damiano crucifixes in every one of the rooms, and as you might be able to see, perhaps not clearly in the center of the photo, each one of our hospitals has a statue of a bronze sculpture of St. Francis of Assisi, so that everyone knows who we are as they're passing by. Here are more manifestations of those religious artifacts, including, as you may see in the leftmost picture, with the American flag, the papal flag, which is displayed in all of our campuses. More artwork, including depictions of St. Francis, and there you can see the Cross of San Damiano, which we display everywhere, including, as I say, in the patient rooms. All the patient rooms have a San Damiano crucifix. We sometimes have a hard time keeping them on the walls because there are always folks who like them so much that they want to take them home with them. By the way, I haven't mentioned this, and I'm not sure it's covered in this presentation, but it is the policy of our board, of our sisters, as well as of our system board, that employees as well as board members are encouraged to make a pilgrimage to Assisi. And to that end, the sisters pay for board members to travel to Assisi. They pay their fees. Executives are also invited to attend. I have been on a pilgrimage to Assisi, as have most of the executives in our system. Extremely rewarding pilgrimage, and it's so popular that a number of folks go more than once. Every year at our leadership conference, we invite employees to participate in a raffle, and the sisters give away about 4 or 5 trips to Assisi to the employees. So it's a wonderful way to become completely immersed in Franciscanism. The sisters operate in the northern Indiana region, in particular runs a number of clinics for the poor. This is the St. Clare Clinic at St. Anthony Hospital in Crown Point, Indiana. Crown Point, some of you may remember from the movie that was recently made about John Dillinger's life. Crown Point is where John Dillinger escaped from the jail after having fashioned a gun out of a bar of soap. The Catherine McCauley Clinic is run by the folks at St. Margaret Mercy. St. Margaret Mercy, as Steve indicated in his remarks, is the product of a merger between 2 hospitals. It's a 2-hospital campus. The Religious Sisters of Mercy used to be co-owners of St. Margaret Mercy. They no longer are, but before they left, they donated funds to start a clinic for the working poor in Hammond. We named it in the honor of their founders. That's how we come by the name of Catherine McCauley, a Franciscan institution. Most people don't understand how a Mercy sister could be, Mercy sister's name could be part of the Franciscan system, but that's the history. The Catherine McCauley Clinic is supported not only by donations from employees, they are extremely dedicated to it, but also by the local casinos. Hammond has a huge casino which draws lots of folks from Illinois into its programs, and the casino also supports Catherine McCauley through some funds that it contributes to the city, which the city then turns over to us. It's a very popular program which probably generates, I don't know, something in the neighborhood of about 10,000 visits this year, I think, something close to that. The Open Door Health Center is a program at our sister hospital, St. Anthony Memorial in Michigan City. This service has now been taken over by a Medicare qualified clinic, but the Open Door still exists and still serves as a fundraising vehicle so that patients who cannot access the services offered at the local federally qualified clinic, in other words, who have co-pays and medication expenses, can have those expenses defrayed by the folks who run the Open Door fundraising arm of this center. We also offer a fairly elaborate sexual abstinence training program. We are fortunate in the state of Indiana to have a formal program called Project Respect, which assists in funding abstinence teaching programs. However, unfortunately, the regulations pertaining to that program have been changed so much that we will not be competing for Project Respect grant funds this year. As a result, as we've done in the past when we haven't qualified for the grant monies, the Sisters of St. Francis fund sexual abstinence teaching and other related programs. This is a billboard that appears in the community and the brochure as well. This is a program that's been extremely successful, very popular, particularly with folks in the public schools who are very eager to have us come in and do the teaching instead of the Planned Parenthood folks. So we are often invited to come in and do the teaching by folks who know that the Planned Parenthood folks are coming and want us to come in first, so it's not necessary for the Planned Parenthood folks to come in. Here's just a brief summary sheet of some of the work they're doing, including Sex Can Wait, Good Touch, Bad Touch, Puberty, etc. So thousands of kids being taught, believe it or not, in the public schools by folks who are representing a Catholic hospital system, and they're very grateful for it. This is the Center of Hope, something we're very proud of. It is a center that was set up to deal with sexual assaults. It is a center that we developed in conjunction with the state's attorney in Lake County, Indiana, as the local prosecutor, with the various social service agencies, the cities and towns in the area, and St. Margaret Mercy. It acts completely in conformance with the religious and ethical directives. It is staffed by a female physician and several nurses who are available 24 hours day, 7 days a week, to care for victims of sexual assault in a separate facility within the emergency room that is completely non-threatening, and as I say, functions in complete accord with the mission of the Sisters of St. Francis and with the religious and ethical directives. It's been very popular. It's the only one of its kind located in the northern part of Indiana, as far as we know, and it has been extraordinarily popular with the nurses as well as the unfortunate victims of sexual assault. St. Monica Home operates at the South Campus of St. Margaret Mercy. It is a home for unwed pregnant adolescents. It is usually nearly full to capacity. I believe we have 7 pregnant adolescents there now, and I think 4 babies, if I'm not mistaken. But it's, as you can see from the lower slide here, perhaps you can't see it very well, it's a very nice home located on the campus of St. Margaret Mercy, and it's in a very kind of a rustic setting away from the hospital itself. The young women who are invited to come to the St. Monica home who express an interest in coming and then have to qualify are expected to work during their pregnancy. They're expected to continue their schooling. They have to earn their allowance. They have to earn the privilege to stay after their baby is born. They spend a great deal of time, obviously, being taught preparation for the birth of their child, and it's been a remarkably successful program, not only in the community with the local social service agencies, but also with the women themselves who go on, in many cases, to lead very productive lives, and also, in some cases, end up working at the hospital. We do offer them positions at the hospital if they're interested, but they must work, and they can choose other places to work if they don't want to work at the hospital. Well, we don't do any stem cell research, but we are certainly big promoters of cord blood harvesting. This is something that our folks have been talking about for some years and have been doing their very best to encourage parents to harvest at the time their children are born, pointing out the advantages of it. We've had some considerable success, particularly at our Crown Point campus. As some of you may know, we have an annual Respect Life celebration. We just had it a couple of weeks ago. This involves several of our campuses. It used to be St. Margaret Mercy's South Campus, but it now involves even our for-profit physician-owned hospital, believe it or not, which has a number of white crosses sitting in the front lawn for everyone in the area to see, along with a sign which basically says these 4,000 crosses represent the roughly 4,000 abortions performed in this country daily. Some of them include red crosses for partial birth abortion. That picture's kind of old, so that's why you may see some darker crosses there. The folks at St. Margaret Mercy lay out drill the holes and put the crosses together, and then we invite local school children to come in and install the crosses. There's a ceremony generally presided over by the bishop. There's singing and great deal of participation by the children. This year, I think we had close to 600 children from the diocesan Catholic schools who came in. Very well received, often publicized. You'll see in a moment how the pictures of the ceremony end up